Think prevention, live long.
This video will explain you the procedure cardiac catheterization. Once you have had a stress test or ultrasound of the heart, and once we determine that your heart needs to have further detailed look, we'll do cardiac catheterization, which is somewhat of a more invasive procedure than the test you had in the office. During the cardiac catheterization, you will be asked to come to the hospital, typically as an outpatient procedure. Once you come to the hospital, the nurse will put an IV in your arm and ask you for a consent and then give you a medicine to relax you. Once you come to the cardiac catheterization laboratory itself, we'll numb the groin typically, and then put a small catheter and go up to the heart, inject the dye, and take the pictures. So if you're allergic to iodine, I need to know about it. Obviously, I'll ask you when I'm seeing you, but just I'll make sure you remind us that if you're allergic to iodine or shellfish or any other type of iodine allergy. Once the cardiac catheterization is complete, the results typically are available right away, and I'll come out and talk to you and your family and explain you what the next step should be. So the typical common things which can happen after catheterization is to get the stent for a blockage. If there are multiple blockages, sometimes you will require open heart bypass surgery. If you find any major heart valve issue, then obviously valve repair or valve replacement will be done. These are very detailed plans, and I will be sitting down with you personally and explaining you, so I don't want you to worry about what the outcome after the catheterization will be, because we'll be discussing in very detail. After catheterization, you typically will go home if there is no any serious blockage, and you will recover within 24 to 48 hours. Most of the time, you'll be able to go back to work in 48 hours. If you have had a stent done, then you will go home typically next day, and sometimes longer depending upon what more procedure we had to do. And in that case, you'll be able to go to work in about a week or 10 days. You know, obviously, if you're going to have open heart surgery, it's going to require much longer time, and I'll explain you in person what the length of the time and what other things will be involved. But the key thing for this video is that if you're having cardiac catheterization, understand the procedure, ask me questions if you have. Let's discuss a bit of the complications and some of the other things about catheterization. The complication rate for cardiac catheterization is less than 1%. Dying from cardiac catheterization is 1 in 2,000, very uncommon. And typically the person who has a major complication is the person who already is sick and is in the emergency room, and then we have done the catheterization. But for outpatient catheterization, the risk is very small. Chances of stroke is 1 in 500, 1 in 1,000. Chances of damaging the kidney from the dye is about 1 in 500. So relatively safe procedure, because we go through the artery in the groin. There's a small chance of bleeding, which is about 1 in 300. Chances of any life-threatening bleeding is again 1 in 1,000. So we have to know the complications, but at the same time, obviously, we will be scheduling procedure only if the benefits of procedure are outweigh more than the risk of the procedure, and we'll make the decision together. If you have any questions or if you have any other concerns, always ask me. If you feel that we can do medical therapy before we do catheterization, if you want to try to exercise, medications, cholesterol control, aspirin, and weight, and then decide about catheterization, I think that would be a fair call, as long as you're not having any major symptoms. So we'll decide those plans together in person. But again, watch this video, take notes, ask questions before you leave. Thank you.
When we think prevention, live long. The heart of mid-Michigan strong.